So just for some examples of what kind of prices we have, in our in-house lab pricing, we have the ability to do a lipid panel, that's a cholesterol panel, for $9, a blood count for $5.76, liver kidney sugar test, that's called a CMP, that's $6.79, thyroid testing is $11.68 for the TSH, and even a Lyme antibody is $18.43. So generally much cheaper than people can get even when they go through their insurance and have a high deductible plan. And then in the pharmacy side, you can see some of our antibiotic costs. Amoxicillin course, $2.40. Atorvastatin is Lipitor, that's $3.30. And even Nexium, which is over the counter now for heartburn medicines, the generic for that is $10.20 for a month, which is much cheaper than what you could buy just over the counter. Now, patients do not have to use our lab, and they don't have to use our pharmacy. We have patients that have great insurance that use their copay, that get medicines covered at their local pharmacy, or they'll go to a lab that they've always gone to, and they continue to do so. So it's really up to the patient, whatever makes the most sense. And we're happy to help patients navigate that. And just on that note, another thing that kind of sets us apart is that we think about costs. You can think of us as a purchasing agent. We know how much things cost. We know where you can get different services for better pricing, and we think about that for our patients. The cost could become a major stressor. Bankruptcy, health-related bankruptcy is the number one cause of bankruptcy in the U.S., and so it's a major issue and a major barrier for patients often in order to get care. So we really think about that, and we look to help control that for our patients. And one way we do that is by helping to reduce downstream costs and testing. And what I mean by that is often if you're in the traditional system where you have such a short time with the doctor, but there may be 4 or 5 issues going on, oftentimes the doctor will say, well, you know what, I'll refer you to orthopedics so you can go get your knee pain looked at. Whereas here we block off 30 to 45 minutes for a visit so we can take care of multiple issues, including that knee pain, and at the same time you're there. So their data shows that direct primary care can help reduce specialist visits, and that will in turn will help decrease costs and testing actually as well. And this benefits not only the employee but also the employer if they're paying for the health care. And we also have a network of specialists where we have talked to them about offering cash pricing, and so we're able to get patients set up for that at an affordable price. So even physical therapy and radiology costs, which has been really nice for patients.